Have you ever noticed that some medical conditions are taken very seriously while others are brushed off? If someone says to you they have cancer, everyone immediately understands the seriousness. But if someone says to you they have high blood pressure, obesity, depression, sleep apnea, the response is, you'll be fine. The reality is that these four health conditions are often the biggest contributors to poor health, disability, and premature death, and are often misunderstood or underestimated. I am Dr. Okoro, board certified in internal medicine, obesity medicine, and lifestyle medicine. Today, let's talk about four chronic healthcare conditions that deserve more respect than they often receive. Let's start with high blood pressure. The biggest problem with hypertension is that the patient feels perfectly normal. Most times they have no pain, no dizziness, completely asymptomatic. This is why it is called the silent killer. Meanwhile, elevated blood pressure is silently destroying the blood vessels. Uncontrolled hypertension can lead to vision loss, kidney disease, stroke, heart failure, heart attack, and a list of other things. Many people don't discover they have hypertension until they have experienced one of these unfortunate complications. Another misconception is that medication alone is enough to control hypertension. While medication is important, other things like controlling your sodium intake, maintaining a healthy weight, reducing stress, getting enough sleep are equally as important in controlling high blood pressure. Respect hypertension before it forces you to. The next chronic condition is obesity. Obesity is probably one of the most misunderstood medical conditions. Many people still think that obesity is a matter of eating less and exercising more. But if that was the case, millions of people will not be struggling with their weight loss journey. Obesity is a chronic disease affected by sleep, stress, brain signaling, metabolism, hormones, medications, and a host of other factors. It also increases the risk of numerous health conditions like heart disease, stroke, sleep apnea, arthritis, kidney disease, certain cancers, and a host of other chronic conditions. Losing weight is very difficult because the body actively tries to regain it. After weight loss, the hunger hormone increases and the body burns fewer calories than before. This is why long-term treatment often requires more than willpower. For many patients, successful management includes nutrition, physical activity, behavioral health help, and in most cases, medications like GLP-1 receptor agonists. Obesity deserves the compassion and medical attention that we give other chronic medical conditions. The next chronic condition is sleep apnea. Many people think sleep apnea just involves snoring. It doesn't. Sleep apnea occurs when breathing stops during sleep. These interruptions may occur dozens or even hundreds of times during one given night. Every time breathing stops, oxygen levels can drop. The brain briefly wakes you up, often releasing stress hormones. Even if you don't remember waking up, your body does. Untreated sleep apnea has been linked to irregular heart rhythms, heart disease, stroke, diabetes, obesity, motor vehicle accidents, daytime fatigue, depression, and a host of many other conditions. One of the biggest clues is excessive daytime tiredness. If you are falling asleep during meetings, struggling to stay awake during driving, feeling tired even when you've had a prolonged period of sleep, do not ignore these symptoms. Sleep is not a luxury, it is a medical necessity. Finally, let's talk about depression. One of the most harmful misconceptions is that depression is just sadness. Clinical depression affects the brain, motivation, sleep, physical activity, relationships, and a host of other factors. Many people continue going to work, raising children, and caring for others while struggling silently every day. Depression affects the body. Many people living with untreated depression have higher rates of diabetes, heart disease, chronic pain, and many other medical conditions. It can make it harder to exercise, eat well, take medications consistently, and attend medical appointments. Most important thing is depression is treatable. Treatment includes lifestyle changes, psychotherapy, medications, or a combination of all of these factors. Seeking help is not a sign of weakness, it is a sign of strength. What do all four of these conditions have in common? They are all chronic conditions and they are not problems you simply get over. They require ongoing attention, follow-up, and management, just like asthma and diabetes. The good news is they are highly treatable. Early diagnosis, changing one's lifestyle, making sure you're seeing your healthcare provider regularly, following those instructions, all can help manage all of these chronic conditions. If there's one message I want you to take away today, it's this. Do not underestimate chronic conditions because you can't see it. High blood pressure can cause damage to organs without causing symptoms. Obesity is far more complex than just willpower. Sleep apnea affects more than sleep, and depression is a far more complex condition that deserves compassion and treatment. The earlier these conditions are recognized and managed, the better the outcome. If you found this video helpful, please share it with someone who needs to hear this message. Let me know in the comments which chronic healthcare condition you want me to cover next, and don't forget to subscribe for more evidence-based healthcare information. Next time, remember, your health is your greatest investment.